Kwekwe, Tanse Onusakut, good afternoon, bonjour. Je tiens à souligner que je m'adresse à vous aujourd'hui depuis le territoire traditionnel du peuple algonquin. Je suis ici aujourd'hui avec Tom Wong de Services autochtones Canada, médecin en chef. Nous venons de franchir le cap du premier anniversaire de la déclaration de la pandémie mondiale de la COVID-19. Les dirigeants, les membres des communautés, les aînés et les jeunes des Premières Nations, des Inuits et des Métis de tout le pays ont travaillé très fort pour tenir le virus en échec. Ils ont fait preuve de compassion, de résilience et de détermination pour protéger leurs proches. Il faut les en féliciter encore et encore. Le gouvernement du Canada a été, en tant que partenaire là, et nous continuerons à soutenir leurs efforts alors que nous poursuivons la lutte tous contre la COVID-19. Les nouvelles sont encourageantes en ce qui concerne le déploiement des vaccins, mais il reste extrêmement important de respecter les mesures de santé publique, de rester à la maison si possible et de rester connecté en utilisant des moyens virtuels si possible. Il existe actuellement des variants préoccupants au Canada et le nombre de cas actifs continue d'augmenter dans certaines régions, ce à quoi nous devons continuer à prêter une attention particulière. Je sais que nous sommes tous fatigués, mais nous devons rester vigilants alors que le déploiement du vaccin se poursuit. Une troisième vague alimentée par les variantes de préoccupation constitue un danger réel et actuel pour les communautés autochtones et pourrait être dévastatrice. A third wave, fueled by variants of concern, represents a clear and present danger to Indigenous communities and could be devastating. As of today, in First Nations communities on reserve, we are aware of 1,174 active cases, bringing the total number of confirmed cases of COVID-19 to 23,514, there being 22,074 recoveries and tragically 266 deaths. I would like to point out that the number of active cases has been gradually decreasing over the past month. I believe that with the progress attributable to the vaccine, the tide is turning and better days do lie ahead. But we must remain vigilant to maintain this momentum. Vaccines are only one of the tools we have to fight the pandemic. To stop this pandemic, we must all use our prevention tools. Work continues with Indigenous communities and our provincial territorial partners to roll out vaccines. Overall, as of yesterday, over 200,000 doses have been administered in 586 First Nations, Inuit, and territorial communities. Starting in British Columbia, we've reached the point where at least one dose of the COVID-19 vaccine has been administered to the majority of residents in First Nation communities. In terms of the numbers of vaccinations, 30,000 doses have been administered, which accounts for approximately 54% of the adult residents on reserve. In the Yukon, 43% of the eligible population has received their first dose of the vaccine, and 25% of the population is fully vaccinated. Additionally, authorities report that there are no active cases of COVID-19 in the territory. Nunavut vaccination clinics have started in many communities such as Arctic Bay, Clyde River, and Iqaluit. There are also clinics administering second doses in Baker Lake, and Coral Harbor, and others. As of March 18th, 17,811 vaccine doses have been administered in Nunavut alone. In Alberta, Indigenous leadership continue to work tirelessly to protect their communities. I had the pleasure of meeting with the chiefs of their assembly earlier this week and will continue to work with them to address many of the challenges that COVID-19 has only exacerbated. Last week, health authorities started arranging appointments for Indigenous individuals to sign up to receive their vaccines. In Calgary, a new clinic opened to administer vaccines to Indigenous elders living in urban areas. This clinic is located in the Aboriginal Friendship Centre of Calgary, which is a trusted centre for Indigenous people for their health and community needs. Moving to Ontario, I'm very pleased to share that Operation Remote Immunity has visited all 31 remote and isolated communities to administer their first dose of the vaccine. The project was a team effort with Indigenous leadership driving the initiative with community members, Orange, and healthcare workers. All of each came together to deliver this critical service. The team has also already started administering second doses, and they expect to be complete by April. In Nova Scotia, 6 clinics in Mi'kmaq communities have administered first doses. Many federal partners, including Indigenous Services Canada, the Public Health Agency, the Canadian Armed Forces, and the RCMP, are tirelessly working with communities, provinces, and territories to respond to the community needs. Right now, The Canadian Armed Forces are currently in Matthias Coulombe Cree Nation in Manitoba to assist the community with their COVID-19 response, along with Canada Task Force 4, the Canadian Red Cross, and ambassadors from the Provincial Coordination Response Team to support efforts, a liaison for my departments in the community to support with coordination efforts and to support leadership any way necessary. Over the past 2 months, members of the Canadian Rangers have worked in more than 25 communities across the Anishinaabe Nation in Northern Ontario, helping provincial authorities with tasks related to immunization. This is in addition to the 46 First Nation communities that the CAF has supported in recent months to manage COVID-19 outbreaks and facilitating vaccine distribution. Several of these communities have been severely impacted by COVID-19 outbreaks, and teams are actively working with communities to ensure essential supplies and fuel are delivered before the close of the season. As announced earlier this morning by the Prime Minister, my department and the Canadian Armed Forces will begin supporting an unparalleled accelerated vaccination program in a number of isolated First Nation communities, as well as a select number of larger Indigenous communities starting in Manitoba. We are currently working closely with public safety and the Canadian Armed Forces to expand on an accelerated vaccine rollout in First Nations communities in northern Manitoba. Over the next few days, we will be working in partnership with Indigenous leadership to assess community needs and ensure the appropriate Canadian Armed Forces resources are sent to communities requiring assistance. This deployment will include up to 23 different communities, and more details will be shared in the coming days as we proceed with the planning. Manitoba First Nations COVID-19 Pandemic Response Coordination Team has introduced their plan to administer 100,000 doses within the next 100 days. The goal is to have everyone in First Nations communities in Manitoba who wants the vaccine to receive their first dose by mid-May. And to date, almost 10% of Manitoba's on-reserve First Nations population has received both doses of the vaccine. Les vaccins, évidemment, ne sont qu'un des outils dont nous disposons pour combattre la pandémie de COVID-19, mais nous savons que nous devons utiliser tous nos outils de prévention pour réussir à y mettre fin. J'aimerais également souligner que près de 400 appareils de dépistage au point de service et plus de 80 000 cartouches de tests ont été déployés dans plus de 180 communautés autochtones ou à proximité. D'autres appareils de dépistage tels que le GeneXpert, ID Now et Spartan arriveront dans les mois à venir. Les responsables régionaux travaillent avec les communautés ainsi que le laboratoire national de microbiologie et les laboratoires provinciaux, bien évidemment, pour fournir des appareils de dépistage au point de service à toutes les communautés restantes qui le souhaitent bien. Before concluding, I do want to take a brief moment to highlight that yesterday, Chief and Council of Wet'suwet'en First Nation confirmed that they had lifted their long-term drinking water advisory, which had been in place since 2012. With this, 102 long-term drinking water advisories have been lifted since 2015. Additionally, 2 short-term boil water advisories that were recently lifted affecting Wabigoon Lake Ojibwe Nation's public water system and Little Red River Cree Nation Fox Lake public water system have also been lifted. And lastly, yesterday, Minister McKenna announced $69.5 million in funding that will go towards 37 clean water, wastewater, and stormwater infrastructure projects for First Nations communities in Ontario. This investment shows that our commitment to support First Nations communities in providing reliable, safe, clean drinking water for all First Nations communities goes beyond Indigenous Services Canada. The Government of Canada as a whole is behind this commitment. Miigwech, Nakumik, Marcy, thank you, et merci. And now I'll pass it over.
Thank you. First of all, I want to acknowledge that I'm on the unceded territory of the Algonquin people. Over the past 2 months, there has been great progress nationally with the number of active cases on reserve declining by over 70%. However, there are still pockets of outbreaks in hotspots across the country. We must continue to use public health measures in order to blunt the anticipated third wave, especially in the context of the spreading of the variants of concern. The National Advisory Committee on Immunization has recommended that all remaining Indigenous adults receive vaccinations in the second phase of the vaccine rollout. We need the help of everyone in order to ensure that First Nations, Inuit, and Métis adults who wish to be vaccinated are offered the opportunity. Je reconnais que nous travaillons fort pour atteindre le sentiment de retour à la normalité. Nous avons fait de grands progrès et il reste important de continuer à travailler ensemble. Miigwech, Nakumik, merci, merci, and thank you.
Merci. Nous allons maintenant répondre aux questions des journalistes, une question et une question de suivi, puis nous allons commencer avec les questions par téléphone. I will now take questions from journalists, one question, one follow-up, and we'll start with questions over the phone. Thank you.
Thank you, merci. Please press star one at this time if you have a question. S'il vous plaît, appuyez sur étoile 1 maintenant pour poser une question. La première question, the first question is from David Thurton, CBC News. Please go ahead. La parole est à vous.
Hello, everyone. Thanks for taking our questions. Y'all are saying that there has been great progress that has been made with vaccines and the cases, the number of infections that you're seeing. What are the indicators that are telling you that the vaccines are working?
Excellent. I'll start and then pass it over to Tom. David, excellent point. I mean, the data that we are seeing is preliminary, and the drop in cases that, in terms of the active cases, just over 1,000, which I would note is a fifth of its high in and around January, is due to a number of factors, including increased vigilance, increased public health measures, better restrictions, product of the lockdowns. It is too early to speculate conclusively on the impact of the vaccine, but we know that respecting the protocol of the vaccine deployment, which is to get to those that are the most vulnerable, to prevent first and foremost mortality, and then severe onset of symptoms and the consequences of sickness that comes from them, and then mass vaccination, has resulted across Canada in the number of cases we see in long-term care settings. And I believe if you look at some of the data in Quebec, they were reporting for some time no deaths in long-term care facilities. We have early numbers that indicate that this is the case for Indigenous communities, but it is too early to draw a definite conclusion as to the impact of the first dose in most cases. But then obviously everyone is eager to see the impact and length of immunization of the second dose. Tom.
Thank you so much. Thank you for the question. We are actively supporting Indigenous partners in Indigenous organizations in order to track the data and the potential benefit and the impact of the vaccine. As we speak, there are tremendous progress being made by a number of Indigenous groups looking at their own data. It is very important that Canada supports, and provinces and territories support First Nation, Métis, and Inuit-led processes in order to assess the impact of the vaccine. Just because the vaccine works very well in clinical trials outside of the country, it may work somewhat differently in Indigenous populations. We must keep in mind that there's increase in the frequency and the intensity of exposure to viruses, and in this case, the coronavirus, the COVID-19 and all its variants. It's important to keep in mind that the social determinants of health in overcrowded housing, with very poor ventilation, with food insecurity, with poverty, with underlying medical conditions, all of those could impact on the level of protection by the vaccine, as well, as the interval, the optimal interval between the first dose and the second dose. And we look forward to some of those results led by Indigenous peoples in order to share, with all of us in Canada to see how well the vaccine works and under what circumstances it works. So, thank you.
David, did you have a follow-up?
Yes, I asked this to Dr. Tam, and I'm going to ask it to you all as well. as more Métis, Inuit, and First Nations, get their first shot or even a second shot, what does that mean for social gatherings? Especially around Easter, especially with the Victoria Day long weekend approaching, Victoria Day weekend approaching. What does that mean for Canadians, for people that want to gather?
Really, David, until further notice, we do have to maintain the strict public health measures, particularly in the face of what could be a third wave that is driven by variants of concern. We have preliminary data on the effectiveness of the vaccine on transmissibility, but that is not a foregone conclusion at this time. You see it in the public narrative as people get hopeful about vaccines. This is very much a group effort, and ensuring that we get to a point where we do have proof points in and around mass immunization. It's too early to speculate about how much you could relax and get to a point where there will be a return to normal. Everyone, I think, is scratching their head as to what that new normal would be. But obviously, once you get your shot, it's not the time to go out partying. We've been at pains, I think, to reinforce that message in communities. Optimism and joy about having a level of vaccination is very normal human reaction. But I think in the interest of protecting everyone around us, we're being very cautious about this. Tom, do you want to add anything?
Yes, indeed. It is so important to listen to public health authorities, both at the national level as well as in the provincial and territorial level, in order to identify the appropriate time. Currently, it's premature to speculate on the appropriate timing for relaxing some of those measures. Do keep in mind that there are children and adolescents. Currently, the vaccine is not indicated because there's not enough evidence for the safety or efficacy of the vaccine in children and teenagers. So therefore, they become a large reservoir for potentially spread, to others. So even when there's actually vaccine for the adults, it is very important to keep that in mind and wait for public health measures to actually take its effects, and wait for public health authorities in order to make those recommendations. Thank you.
Thanks, David. Operator, next question, please.
Thank you. Once again, please press star one again at this time if you have a question. N'hésitez pas à appuyer sur étoile 1 pour toute question. The next question, la question suivante, est de Lina Dib, la presse canadienne. La parole est à vous. Please go ahead.
Oui, bonjour, Monsieur Miller. Moi, je voudrais vous poser une question sur ce qui est arrivé à Madame Ottawa, à Joliette, ces deux infirmières qui ont été congédiées. Et depuis, j'imagine que vous suivez ça d'assez près. Vous avez dû savoir la nouvelle version offerte par le syndicat. Alors, j'aimerais entendre vos réflexions sur cet épisode.
Lina, franchement, évidemment, j'ai vu les nouvelles ce matin. Je me pose la question, s'il n'y a pas de racisme, il y a quoi donc? Y a-t-il lieu de parler de quelque chose de systémique? Moi, je crois que oui. Franchement, il n'y a personne qui m'a personnellement demandé si je pouvais faire de la claquette avant d'avoir un service à l'hôpital. Là, on a demandé à la madame si elle pouvait chanter quelque chose en Atikamekw. Il y avait peut-être un esprit de sympathie derrière ça, mais vous pouvez voir ma réaction. J'ai encore des questions comme vous et comme tout le monde devrait l'avoir. Il reste que dans toute discussion qui entoure le racisme systémique, l'impression qui a été laissée sur une personne qui était certes dans une situation très vulnérable parce qu'elle est allée chercher des soins en santé, en était un d'exclusion et qu'elle sentait qu'on se moquait d'elle. Donc, selon moi, c'est une leçon. Il y a encore des faits à découvrir, mais franchement, selon moi, selon les faits, je me pose encore des questions. Peut-être au niveau de la formation que ces personnes ont eue. On sait très bien dans les discussions de racisme systémique, on a beau congédier à volonté, mais après qu'on a congédié tout le monde, il y a toujours le système qui perpétue cette façon de penser. Ben, je conclue ma pensée là-dessus. Je pense que vous pouvez en tirer les conclusions.
Oui, donc en suivi, si vous m'entendez encore, si on accepte la version du syndicat, ce serait plus une question de malentendu. En plus, une des deux infirmières a suivi une formation et peut-être qu'elle l'a comprise tout croche. Alors, s'il y a une question de malentendu, comment est-ce qu'on peut éventuellement régler ce problème? On a l'impression que ça se réglera jamais, que les deux communautés pourront jamais se comprendre.
Pour moi, c'est une réflexion à deux volets. De un, on sait très bien que ce n'est pas une question de solution à court terme. Puis il y a des situations où on doit congédier du monde pour leur comportement. Et il y a des situations de réhabilitation, d'éducation. Il faut croire en la réconciliation pour savoir que ce n'est pas quelque chose nécessairement de linéaire ou d'évident. Je pense que la communauté Atikamekw serait la première à vouloir sensibiliser, à continuer de sensibiliser. Ce n'est même pas leur job, c'est à nous qui ne sommes pas autochtones de comprendre leur situation, mais surtout d'avoir une meilleure éducation en ce qui a trait à leur réalité et surtout dans des situations de vulnérabilité comme dans les soins de santé. Donc, encore une fois, comme tous les Canadiens, comme tous les Québécois, je suis un peu navré, mais c'est à continuer. Puis, forcé de constater qu'on parle d'un système qui continue à faillir aux peuples autochtones.
Merci, Lina. Nous allons maintenant prendre des questions dans la salle. We'll now take questions in the room. Go ahead.
Mr. Miller, Mike Liquiteur with Global National. I wanted to follow up on that question of Ms. Jocelyn Ottawa and the union claiming that it's more misunderstanding than mocking. From what I heard, what you said in French, you're not buying that excuse that they're saying, and I wanted to know why you don't think so, and why you think that this is an explanation after the fact that doesn't hold water.
Look, Mike, I'm not going to question what the union said. I think the explanation itself, I will have questions about it and the facts that surround it. As I said in French, no one asked me, I don't know what the claquette is in English. I think it's originally an Irish dance, but no one asked me to sing a jig or do a little jig before getting healthcare services. And yet, apparently this person was asked to sing in Atikamekw. Maybe the sentiment behind it was there was some good faith, but come on, it doesn't make sense. And this is about getting first-class care to people who have been denied it in a system that in a country that prides itself on its healthcare system, its equality and access for all. And Tom and I are spending countless hours trying to deploy a vaccination strategy that treats Indigenous peoples as first-class citizens. And we see the challenges. If it wasn't racist or bigoted, then what was it? And I think then you get into questions about what systemic racism is, and that you can't address it through successive policies of what equates to some form of whack-a-mole. You could fire everyone, but at some point there's not any more people to fire, and you have to start talking about the system and perhaps the course that these people were given. I don't like to indict any particular individual without a whole set of facts, but when you start seeing behavior and a system that perpetuates that behavior, then I really do think you have to have a discussion about the system and how it treats Indigenous peoples, in particular those that are felt vulnerable. Any discussion about systemic racism is about the impact left on those who suffer it. And we've had this discussion around use of words, use of language, but you have to have a sensibility and sensitivity to the impression that might be left on someone that is at their most vulnerable at the point of care in the healthcare system. And once you realize that, then you realize that there needs to be a better, more long-term approach as to how the healthcare systems across Canada interact with Indigenous peoples, foremost at the point of care. And then you realize that there may be some short-term goals and short-term objectives that you can achieve, but widespread reform is a little longer. And if you think it's short-term, then you're not understanding the problem. So I guess that was my reaction.
For my follow-up, I just wanted to talk more about the numbers that you're seeing in Indigenous communities. I mean, both of you seem, cautiously optimistic about it. How nervous are you, though, that as the vaccine is rolled out, that it builds in this level of confidence that might see, while the rest of the country, Ontario specifically, is going to be in a third wave here, or in the middle of a third wave, that you might see communities take their foot off the gas because they feel like they have some immunity from the vaccine, and that they won't sort of follow through with it as a result. How nervous are you? Because I'm sensing that from you guys.
Yeah, just as a matter of, we all see the light at the end of the tunnel without realizing how much tunnel is left. And when it comes to, as Tom said earlier, when it comes to Indigenous communities, the socioeconomic gaps create determinants of health that are such that make Indigenous communities more vulnerable. We've been talking about this since the beginning of the epidemic, and we have the proof points, particularly in the U.S., to show it. We are still at a fifth of the active case rate that we saw in the mid-Januaries, but it is still unacceptably high. And with variants of concern that could spread, you simply need to look at overcrowding in housing to know that your ability to keep your R rate under 1 is severely impeded in a household of 15 or 20 people, whereas in a household of 2 or 3 people, it's a little easier. These are just facts that we have to deal with. And so human nature being what it is, and I don't want to impugn Indigenous communities, they've done an exceptionally good job at dealing with overwhelming odds, and they continue to fight these odds with measures and supports that we don't have to deploy in non-Indigenous communities, repurposing schools and houses and community buildings to isolate. And we're deploying the Canadian Armed Forces to take extraordinary measures where communities, through no fault of their own, get overwhelmed. So when it comes to a variant of concern and the deployment of the vaccine, it is we need to keep, I think, our foot on the gas pedal to make sure that the public messaging about social distancing and isolation needs to be reinforced, so that this is not all for naught. And there are active discussions around the spacing between the first and the second dose, active discussions about who gets vaccinated in communities. There's some Indigenous communities where the youth population is very high. So that's a concern, because what that means, without confirmation that we can deploy the vaccine to younger segments of the population, is you have a lesser aggregate that is vaccinated, therefore the capacity for spread. These are all factors that play into each other. And Tom obviously, I'm eating up his time. He's the doctor in the house, but it does worry me, and when it worries Tom, it worries me twice as much.
Absolutely. I echo what the minister just said. It keeps me awake at night because of the potential if we let our foot off the gas. I think that the third wave, will be so high that there will be tremendous consequences. And all we need to do is to look at the second wave, what happened, when there's parties going on, large gatherings going on without masks, without any public health measures, and there's hundreds and hundreds, of cases as a result. And in particular, we need to actually look at the variants of concerns. Many of, these variants are much more transmissible. And I think that it's so important for us to be helping each other. Keep in mind, that the public health measures, need to be staying to protect not just ourselves, our family, as well as our community and the whole country. Thanks.
Thank you.
Mia Rabson from the Canadian Press. You just spent a lot of time talking about the impact on First Nations of housing and the impact that it's had, the overcrowding housing is having on this pandemic. 5 years ago, we were told that there was already a $30 billion gap in infrastructure for First Nations alone. The Infrastructure Bank has dedicated $1 billion. How is that nearly adequate?
Well, it isn't, and that number, 30 billion, is a rough number. It may not be the entire portrait of the infrastructure gap. We know that $1 billion in sort of a leverage type of financing is only one of the tools that you would offer to Indigenous communities. I think it is an important tool because what it does is allow discussions around supporting the business initiatives, small, medium, and big business. I mean, we all saw the Clearwater deal, which is, for a lot of people, something very inspirational because we're not talking about Indigenous big business. And so the projects that the infrastructure banks, that if you recall some of the criticism around the infrastructure bank is that it only dealt with big projects, et cetera. This is an enlargement of what it does, and it will support economic initiatives that may deal with getting people off diesel. It may deal with more solar power, wind power initiatives. It could deal with various types of roads, whether it's resource or not. I'm speculating, but it is a broadening of the infrastructure banks, or more specification of the infrastructure bank's mandate to focus on Indigenous peoples and all the brilliance and entrepreneurship that exists there. It's not intended to fix the housing crisis, not at all, and that falls under the responsibility of CMHC. My responsibility in terms of self-governing nations, it falls under Minister Bennett's responsibility, but indeed it's a whole of government initiative. The successive budgets of our government have invested, whether we're talking about billions and billions for clean water, billions for housing, to address the housing gap. Those are all initiatives that we have invested over the last 5 years and will continue to invest in. I have the mandate in my mandate letter to come up along with the Minister of Infrastructure with an infrastructure plan that'll give us a better snapshot of really those needs that you cited that are very rough, and I'll admit it, I think everyone will. But they are there and they are driving. And I think with the novel thing that we have seen through COVID is, in the case of housing, it's really, it should be seen through a health lens.
Thank you. And I know you've also talked a lot about concerns that the hesitancy to get the vaccine is higher in Indigenous communities, but Veldon Coburn, an assistant professor at the University of Ottawa, says that there is actually no evidence that that's true. So I'm wondering if you can cite the evidence that you have that suggests that there is a higher rate of hesitancy to get vaccines amongst Indigenous communities. Frankly, at this rate, and the outcome may not be the product of whether there is a lack of it or not and what the causes are. We know that there are challenges getting vaccines in communities. First and foremost, the prioritization of vulnerable communities. The article, I read parts of it, and I'll probably go back and read it, but I think the point the professor was trying to make is that we can't infantilize, that's an English word, we can't infantilize the situation. And I think, he raised issues of trying to be woke, and I get that. The point is that, we've heard it from successive leaderships, health authorities, that there is a set of challenges. There are colonial legacies. I think that has created a sensitivity and has created within our department a need to ensure that we're listening locally, that we are empowering those local health leadership professionals that know how to deal with pandemics. I mean, the one thing we've realized through COVID is that if we trust each other, and that if we empower those communities to do how they know best to protect their peoples, it actually works with the outcomes that are proven. When it comes to vaccines, two of the preliminary conclusions we have is ensuring that we respect local leadership, especially health leadership, that we provide as much information as possible. People are smart, and they will choose the right thing. But getting that information in a culturally sensitive way, in some cases when we're talking about the oldest in their languages, and that is a matter of respect for that matter as well. There are colonial legacies that have created a healthcare system that has systemic racism throughout it, and people that approach the healthcare system with great hesitation. But that can be softened with a better approach that we have seen in communities, and I think it's something that our teams do deal with. I think I got the point the professor was making, though, and there's some elements that I, in fact, respect.
Thanks, Mia. And that concludes today's press conference. Thank you.